the high concentration mask, also known as the non-rebreathing mask, and is usually used when high concentrations of oxygen are required, for example with a critically ill or unstable patient. The patient breathes from the mask and the inspiratory valve opens so that oxygen is taken from the reservoir bag. The patient breathes out through the expiratory valve. Ideally, the patient does not breathe any room air. However, the fit of the mask and the patient's breathing pattern will affect the amount of room air entrained and the oxygen concentration delivered. The improved fit achieved with the new generation of Intersurgical EcoLite masks minimises the amount of air that is entrained through the sides of the mask, and hence oxygen concentrations greater than 80% can be delivered to the patient. This improved performance, however, makes it necessary to include mask safety valves. In the event of the oxygen supply failing and the reservoir bag emptying, the safety valves will open, allowing air to enter the mask and the patient is still able to breathe. When using the high concentration oxygen mask, first attach the oxygen tubing to the oxygen flow meter and set the flow rate to 15 litres per minute. Occlude the inspiratory valve, being careful not to damage the valve and allow the reservoir bag to fill. Squeeze the reservoir bag to test the patency of the valve between the reservoir bag and the mask. If the reservoir will not empty, discard the mask, choose another and test again. Refill the reservoir bag and place the mask on the patient's face, obtaining a tight but comfortable fit. Adjust the oxygen flow rate so that the bag deflates by no more than 1/3 at the end of inspiration. When a mask is in place, be aware that aspiration of vomitus is more likely. The high concentration mask, also known as the non-rebreathing mask, and is usually used when high concentrations of oxygen are required, for example with a critically ill or unstable patient. The patient breathes from the mask and the inspiratory valve opens so that oxygen is taken from the reservoir bag. The patient breathes out through the expiratory valve. Ideally, the patient does not breathe